From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush. Dale Bertrand, welcome to the show. Really excited to dig in all things healthcare SEO with you. For the folks that don't know you, maybe just give a brief introduction to yourself and your company.
So thank you for having me, first of all. I'm Dale Bertrand. I run Fire and Spark. We focus on SEO, so I do a lot of speaking and writing on the topic of SEO. I have a technical background, so I worked in engineering and software before I moved over to marketing in 2008. Around that time, I started doing consulting, and that eventually turned into the agency I have now. And now I run Fire and Spark, where we only do SEO. So we are totally focused on Google's algorithm and other search platforms because we only do SEO.
I'd love to just dig in first. You have this term, I think it's purpose-driven or purpose-built SEO. Maybe just give us an overview of what that means to you and how you use that to approach the clients you work with.
Yeah, so purpose-driven SEO is really about showing Google the authority signals that Google wants to see and the engagement that Google wants to see. So you can imagine a purpose-driven brand. And a purpose-driven brand, it builds you've got a community around the brand, and you've got customers that engage with the website and come back repeatedly. And not only do they come there to transact, but they might be interested in what's going on with the brand, so they linger on the site. Google sees all of that engagement, and we know that a purpose-driven brand is more likely to generate that type of engagement. So what we found when we were working with brands, especially in the healthcare space, where the entire purpose of every healthcare organization is to improve people's lives, that we can dig into the specific purpose behind the organization that we're working with and surface that in a way that the market understands what they're really about, what their mission is, and use that to drive the signals that Google is looking for to rank them higher and send them better traffic and do customer acquisition, which is patient acquisition at the end of the day.
What I hear in that is almost like brand exploration originally too. Do you find yourself having to go in and do that level of work, or is it more the client's there and you're just amplifying it?
We're amplifying it. I mean, we're working with brands that have already been established. So, they know what they're about. They know who they're talking to. They know what their messages are. We're making sure that Google sees the technical artifacts of all of the goodwill that they're generating in the marketplace with their branding efforts.
When your brain shifts to the category of healthcare, does it start to think differently? Like, is healthcare different in the category of SEO?
It is. It is because Google sets a higher bar for healthcare content and healthcare websites. You can imagine if somebody's looking for information about a condition or a treatment, or they're looking for a provider, and Google sends them to someone who's unqualified or a website that's giving bogus or malicious information, that can be catastrophic for someone. So for that reason, Google sets the bar really high for medical information. You can't just, I could go online and create like dalespharmacy.com tomorrow and sell you packages of dirt from my backyard and tell you it's gonna cure every ailment you've got, but it's not gonna work. And because I'm making a medical claim online, Google's gonna judge that very harshly unless I can prove it, back it up, and I'm somehow affiliated with some established organizations in the space.
So now with AI coming into the space, when does that come to the fold? And additionally, how does that make you think within healthcare to that point of like especially from the content or the generative side of healthcare information?
Well, you can let me know what path you want to go down, but really three things that are changing: the platforms themselves, which is Google and other search engines, but also the new generative AI search platforms like Perplexity and ChatGPT. But in addition to that, marketers are using AI. Everybody listening to this is experimenting and trying to figure out what they should be doing with AI at work. But that's the second piece of it. And then there's a third piece, which is that consumers are using AI to find information and make decisions around products and services. And they're trying to do self-diagnosis with it. And we all know how that's going to work out. But those are the three areas that are changing because of AI. And there's a lot going on in all three.
Yeah, let's start maybe at the top. I'm curious, is it, I mean, I've heard you talk a lot about AI overviews and kind of how it's cannibalizing top funnel informational. How do you think about it when you dig into healthcare?
Well, I think if you step back for a moment, like really what you have to keep in mind is that, and this is getting into the last one that I said, like consumer search behavior is changing. So the people who are looking for your services, like your patients, they're looking for information and they're looking to make a decision. Maybe it's information about a condition they know they have or a symptom and they're trying to get a diagnosis. And when they're making a decision, they might be looking for providers near them, or they might be trying to find information about a specific provider or comparing two providers. Those are two types of searches. One is information, one is decision making. What we're seeing, we're at the very, very early stages of it, but what we're seeing is that consumers are using two types of search engines for those different types of searches. Imagine a consumer that uses ChatGPT for medical information, which is scary. I get it, but they're doing it. Like, we just have to acknowledge that's what's happening. And then when it comes time to actually book an appointment with a provider or find a provider that's within driving distance of their home, they go to Google because they're looking for map listings or local listings because now they're ready to make a decision. And that's really the way that marketers should be looking at it from the highest level, that like understanding what are those search intents that your customers in your market who are looking for your service are going to be searching for when they're looking for information, and understand that they're going to be searching for that in generative AI engines more and more. Right now, everybody's still using Google. And Google is also a generative AI engine with its AI overviews. But the implications of that for marketers is there's going to be more zero-click search, less likely that they're even going to come to your website until they're ready to make a decision. And that's the important thing. When they're ready to make a decision, what information are they searching for? Are they searching for pricing, locations, comparison, because there's two different providers within driving distance of their home? So we really want to be focusing on those two different types of searches, making sure we understand what our target customers looking for with those two different types, and providing the right type of information for those two different types of searches.
If I mirror that back, I guess to make sure I understand, then there's users that are going on one platform to make their informational search. Like if it's the higher level, top funnel healthcare queries. But then when they're in that kind of transition to potentially trying to find a brand or a care or a provider, they're a little context switching potentially to more search, Google, Bing based.
That is the right model to have in your head, keeping in mind that right now, the vast majority of the people you're trying to reach are still using Google, right?
Mm-hmm.
But we can see the beginnings of them being, learning to do what I'm talking about. So, and so I'm really looking at, so at my agency, we work with brands who are interested in like the future of SEO. What should they be building now that's going to work at the end of 2025 going into 2026? So that's what we're talking about.
And to talk us through that then, what does that framework look like if we're kind of losing the top funnel informational to zero click? What's the framework that you're bringing to your clients on how to think about future proofing your SEO?
So you think about the informational. So what it used to be is you do a lot of blogging, and people who might be looking for specific information about symptoms, medications, conditions, the doctors, specialties, all of that. They'll land on one of your blog articles and they find more information about your organization, and then maybe they book an appointment, right? But now they're going to be looking for that information and being educated by generative AI. If your brand does show up, it's a branding opportunity, not a lead gen opportunity. So instead, the focus shifts to what we would call like middle of the funnel or bottom of the funnel, which is what I'm calling decision engines. Something like traditional Google search, where you can target people who they know what problem they have. Maybe they know that they need a doctor in certain specialty. And now they're looking to compare different specialties or compare different treatments. And they want to know which ones are available to them at their price range or their location, or whatever else it is that they care about to make a decision, the criteria that they need to make a decision. So the type of content we would offer, we like to work on really content that Google's AI overviews can't summarize. So imagine if it was a pricing tool, or if it was a database. It might be a database of like patient outcomes, and not a data-driven article. Because data-driven articles used to be blog articles with numbers in them. It's like, yeah, I know there's 3 numbers in that article, but it's not a data-driven article. A data-driven content would have a database behind it. So you can search it and find out whatever information you might want to find out. And imagine if I'm going in for a procedure. I might be a little bit nervous. Maybe I don't want to have this procedure at all, but my doctor tells me it's medically necessary. And I'd love to understand what the outcomes are. Nationally, or maybe at your facility. That's the type of information that Google's AI can't summarize, and it would only be available, it'd be proprietary. You have to be very careful about making that type of information available, publicly available, because of HIPAA compliance, like at the end of the day anyway. So we've got to figure out how we're able to even do this, right? But as marketers, these are the types of problems we need to solve going forward, so that if we just continue to create blog articles about like, hey, how do I treat this type of symptom or this, then what you're doing is you're working for the open AIs of the world. You're working for the AI companies by building their training, and you're going to get less and less traffic for it. So that's not what we're recommending going into the second half of 2025 and 2026. Now folks who are listening to this are like, Dale, what are you talking about? Like, I'm still getting plenty of traffic on my blog articles. Yeah, I get that. That's today. We're building for the future, and the future isn't that far away.
I think what you're walking us towards, I'm curious, another term that I've seen, I think Fire and Spark really lead with is this human-oriented authority building. And something I saw underneath that you guys purport is that you demonstrate real-world authority online and off. Tell me if that's the lens of kind of what I'm hearing, is you're really helping clients surface what it is about them in the real world that positions them as authority, and bring that much more online.
Yeah, that's part of it for sure. So with Google and other search engines, but really focused on Google for this, Google's looking at a lot of different signals to determine how authoritative your brand is. Some of us are fortunate enough to work for like an established institution that's been around forever, has a lot of goodwill, has a website with backlinks and research papers and all that. Like, it's very easy in that circumstance for Google to understand that the content published on that website is authoritative. But then others might work for like a one location clinic, or an independent physician who just graduated from medical school. I mean, who knows? And basically the practice is much, much less established. And then what Google's doing is looking at the site and saying, well, should I trust it? Like, is the doctor licensed, first of all? And then from there, like, are their patients happy with the service? Does the location even exist, or is this some kind of spam site? Are they affiliated with institutions and medical schools? Have they done any research? Are they mentioned in any research papers? And then on top of that, when people come to the website, do they stay on the website? Do they immediately bounce because it's not what they were looking for? What Google wants to see is people are coming to the website and they're staying there. They're reading the content. They're going to multiple pages. They're booking an appointment. I mean, that's what Google wants to see. And then Google's also looking at the information that you publish on your website. There's been a lot of controversy in the medical space around Google's treatment of medical information when Google sees that the information on your website is outside of the norm. So like, if Google sees it's outside of the norm, like, Google's measuring that, they're less likely to trust it, because it's not the established medical orthodoxy in that field. And they don't trust it for good reason, because it's risky. But that doesn't mean that like new treatments can't exist and gain traction online, or like medicine is scientific, right? And scientific breakthroughs happen all the time, which means that there's going to be new medications, new everything all the time. So Google's got walking this kind of tightrope there. So you have to be careful. But really the way to think about it is what Google's doing is adding all of these things up. If you're at a site that is established, there's a lot of backlinks, the medical information is what Google's expecting. And when people come to your website, they're engaging with, they're staying there, they're booking appointments. Now all of a sudden you've got all the signals Google's looking for, and that's the type of information that Google is going to rank highest. If you don't have those things, then you have the less of those things you have, the less likely it is that Google's going to trust you.
It sounds like the line I think we're towing into is medical consensus. And I'd be curious, I know we don't work at Google, but like, how do you start to think about the lens of where that line starts and stops?
I would. So Bryan, you and I are not in the same room recording this, so I can insult you and you can't smack me. But I think that's the wrong question, Bryan. I really, because it's not just the way to think about like a search engine like Google is there are literally thousands of signals, like criteria that are going into ranking your pages and determining the authority that your website has. So the medical consensus signal is one of many signals. And we don't know how it's weighted compared to all of the other signals. So yes, we know that is something that Google is measuring. We don't know how much it factors in, is what I'm getting at. So I'd be very careful about worrying too much about that. Like, we know that if a large established medical institution publishes information that is outside the medical, outside of the norm, it will get ranked because of all of the other factors. Where it comes into play is when you have like not much else going for you in terms of authority, and on top of that, you're trying to publish some information that Google's never seen before, and Google doesn't understand why you're making these recommendations. That's when Google doesn't trust you.
Yeah, fair enough. And we're here to learn.
Everything else is in the gray. Everything else is in the gray.
Yeah, if my questions aren't what the right ones that should be asked, don't hesitate to come back with the right ones.
Yeah,
we're here to learn for a reason.
I'll pay for it. I'll pay for it in person.
Yeah, fair enough. No, that's it. There's an expertise that you have that resonates with this kind of dynamic shift from what I've heard you talk about of rules-based into now this kind of human-oriented algorithm. And that's the lens of what I hear from you that I think is so unique about this space. That there's still a lot of people looking at this at like, well, what are the rules to SEO? What are the rules to on-page optimization? What are the rules to site speed metrics? There's so much still in that headspace and not where you are.
Yeah, it's tough because you need rules in order to do the right thing. So, without those rules, then the advice just becomes, do the right thing. But what Google really wants, and it is good advice, is to do the right thing for your patients, to really think about what information do they need to make the decision. And you might be asking them to buy a medical product or book an appointment or stay with your within your hospital network for a treatment. But what information do they need to make that decision? And even better, think about what information could you provide? Remember, I talked about outcomes for a particular procedure. That's the type of thing that you can't get that. That's really hard to find. Very few facilities are willing to really publish that type of information. And maybe it's for liability reasons. You can get a lawyer next time, Bryan, on this podcast to talk about that. But I'm a marketer, so I'm saying I want to get information online that my competitors' lawyers won't let them put online, because that's going to help me to attract attention to the good work that my team is doing.
We have had lawyers, and that's a funny conversation, and we can talk about that. I don't think it's legal that's holding back why people aren't publishing outcomes data, but that's another conversation we can have.
Yeah, and I want to hold that up as an example of just as marketers doing the exercise of thinking, what is that information that our customers would love, but for whatever reason, we haven't historically made that information available. That's really the key.
What I hear from you there too, that's back into something I've heard you just simply say as well, is Google promotes brands that treat their customers well. In this lens of conversation, it could be Google treats brands that treat their patients well. Is that another kind of, I hate to use the word tactic, but outcome, I think is the word you use that you think about now of working within healthcare brands to surface how well they treat their patients or not?
Yeah, I think I'm really glad you brought that up, because one way to think about SEO is exactly what you're saying, where it's like, well, what are the rules? Like, what is it that Google's looking for? And at the end of the day, Google is a technical software, very complicated piece of software that can only look at technical artifacts of all the human things that we're talking about online. Things like clicks and dwell time on pages and backlinks and the structure of your website and the copy and all that. That's all the only stuff that Google can see. But what Google actually cares about is the stuff that it can't see directly, which is how well do you treat your patients? Should Google recommend your practice over the practice down the street because of a variety of reasons? It might be that your patients love you because of the pricing or the outcomes or the way they're treated or the convenience, or there's parking out front, which is a problem for us in Boston, right? Like whatever it is, that's what Google actually cares about. It's just that Google can't measure that directly. So then when you start having SEO conversations, you have two types of conversations. Like one about, okay, what are the technical things that Google can see so I can make those happen? But before you go down that path, what I would say is, there are like hundreds, maybe thousands of PhD computer scientists at Google that are trying to outsmart you, and they probably will. And you don't know how the algorithm works, but they do. So if you're trying to outsmart them by putting like the technical bits in the right place and put this tag here, and if I put this word before that word, then it's like, whoa, slow down. Like that's not the way SEO works. That's not going to be effective. You've really got to go back to first principles and ask yourself, well, do you treat your customers well? Let that sink in for a second. And what would your customers say to that? How would they answer that question? And if your patients aren't like resoundingly, 5-star, here's the reason why I love this practice. Oh, my doctor, I would never leave for these reasons. Then that's what you need to fix first. And that is the hardest thing, to get technical people or digital marketers who are used to hiding behind analytics to understand.
That's a really fair point. And I feel like it probably ends up being just even like a filter question of who you work with. Because the lens we always say is we can't make you an authority. Like that's something you have to establish first.
Yeah, the trick is, and I'm just giving this advice to anybody out there who might be doing digital marketing and looking for a new employer, maybe you're in between jobs. You just got to look for an employer that with customers that love them. Like obviously you don't want to work for, you don't want to work anywhere where the customers hate them and you're going to be involved in that. And yeah, you're not going to have the resources you need, and the systems treat the customers like crap. And that's really where it starts. I'll tell you another story. Like I worked with a brand, not in healthcare. They were an e-commerce brand. They were in Europe, and overnight they lost like 95% of their traffic, and they didn't know why. And it wasn't connected to anything. So they called me, and the CEO said, "Hey, Dale, I heard you're really good at SEO. I want you to figure out what's going on here because our business is getting killed. We're losing millions of dollars a day." So I took a look at their site, and it was perfect. It was pristine from an SEO perspective. They were doing everything right that I would tell them to do from a technical perspective, backlinks, copy, everything. So I went online, I typed in their brand and the word scam, which I've learned how to do over the years. And it turns out their customers did not enjoy doing business with them. Let's put it that way. Their products weren't arriving. If you call their customer service line, you get dead air. You're just wasting your money if you try to do business with these people. So I got the CEO on the phone. I said, "Sorry, I can't help you." And he tried to appeal to my ego. He's like, "Dale, my friend over at whatever, he told me you're the best SEO on the planet. What do you mean you can't fix it?" And I said, well, I didn't say it this way, but I said it actually really, really nice. But what I wanted to say was, you're running a shitty business. I can't help you. You treat your customers like crap. I can't help you. Your customers hate you. You need to close down the business and start a new business under a new brand name, new website, new domain, treat your customers well, build up a positive reputation, and then call me in a few years. Like that's the answer. But of course, we didn't want to hear it.
No, but I appreciate the example. I mean, I think equally on our side, we have the same thing happen where we call it like we just put a spotlight on your practice. If there's cracks, it's only just going to show much, much greater and exemplified by bringing you online that way. Like we can't make you a good doctor. And it's a hard thing to say to someone, but it really is at its core where SEO can and cannot be applied.
And it's true for all of marketing. I mean, just some inside baseball just between us marketers. Like you want to work with a brand that you can market, that it's got the right messaging. Customers love it. It's positioned properly. They're unique in the marketplace. They're not a commodity. And that all starts way before you ask anybody to do your marketing.
I hate this question, but I feel like you're the right person to ask. And this is like, what am I not asking you? Like, where is this market going that Dale's head has been in? Where is he spending his time?
I'll tell you what you're not asking me. And I'm going to turn around a little bit on you, but then I'll answer the question. Like, do you do marketing for a living?
Yeah, we're digital marketing within healthcare. Yeah.
What you're not asking me is if you're still going to have a job in 3 years.
Okay. Why? Why is that question so important?
Well, so what I've been thinking a lot about is like what AI can do and what AI can't do. And I would really implore like anybody listening to this who does marketing for a living to think about the tasks that you do on a daily basis that are tedious, that are automatable, that basically a better version of ChatGPT could do for you, a version of ChatGPT that can see your screen, click the buttons that you click, and that's the type of technology that will be readily available to our employers in 3 years' time. Is my best guess as when that's going to happen. And all of us, including me, do a lot of that type of work in addition to the work that we do that is truly creative and strategic and people facing. Like Bryan, you and I do agency work, so the world is always going to need people who can work with business owners and physicians and other marketers that are trying to figure out their business, because those are people skills, right? And I don't see AI replacing that anytime soon. But if we're all honest about the tasks we do on a daily basis and do an inventory of which of those tasks are automatable, now is the time to just open your eyes and push your career in the direction of the creative and the strategy and the human skills. Because we all know that there are marketers out there that are doing the type of work that is not creative and not strategic and not human. And I just real talk, I just want to be honest with people about what's coming. Because I've been pretty deep into AI for many, many years now. And I feel like not everybody is eyes wide open in terms of how this market is about to change. I mean, think of it this way. Like I had a friend who used to be a travel agent. That used to be like a profession. Elevator operator used to be a profession.
How do you think about the responsibility, or I guess the description underneath that? We're still using the word SEO, but it is fundamentally different. So how do you think about like, what is it? I hear categories of creative and strategy, more human. Like, is there more color you can add to that of where Dale's looking?
Yeah. I think like with SEO definitely started out technical. What are the technical things I need to do on my website so that I rank higher, I get more traffic, I make more sales. And you do those technical things, you win. Done. Then we slowly added a PR function to do link building, let's say. And then UI, UX, so that Google can see the engagement signals that it cares about. And then organic traffic became part of this multi-channel conversion funnel, so that we've got to make sure that we're playing nice with the other channels that are basically touching our customers before they convert. So we as SEOs need to understand a little bit about those channels too. So I think the direction that it's headed is not only do all marketers, including SEOs, need to understand AI technology and other technologies like automation that are emerging, but in addition to that, search means something different. Search used to mean people using Google. Now it means people who want something, people who are making a purchase decision. Well, if you're making a purchase decision, I would ask, well, like, why haven't you hit the buy button yet? Because you don't have the information you need. You haven't found what you're looking for. Okay, great. I'm an SEO. I can help you with that. Are you talking to friends to find the information? Are you looking in private communities? Are you on social media? Are you on TikTok, YouTube? Or maybe you're on Google like a dinosaur. I'm just saying that's not true. That's not true at the moment. But I'm just saying, in many years from now, that's the way we might think about it. But it's still search. There's still human needs and humans looking for products and services to fulfill those needs. It's search. So that's how I define search. That's how I define SEO. And that's how my clients, the brands, hire me to do SEO. And even with all the changes going on with Google algorithms and generative AI platforms, they still need me to help them with search because their customers are still searching for products and services similar to what they sell.
So it's 3 years from now. What are the roles or what are the people under Fire and Spark doing? Like I know we're still talking SEO, but what does that look like for you? Like where has the landscape shifted in the skill sets that you're looking for? And
so the truth is I don't know. I'm happy to speculate because it's fun for me, but I'd be lying if I said I knew. For my agency and the marketers that I work with and the marketers listening to this podcast, what's important is adaptability, because none of us has a crystal ball as to exactly how these trends are going to play out. What we know is change is coming. What we don't know is what the other side looks like, right? So then adaptability is understanding the technologies, understanding strategic marketing, moving up the totem pole, so to speak, at your organization and making sure that you're learning. Imagine if you're at an organization that is ignoring AI, not investing in AI training, and then think ahead a few years when you're in the marketplace for jobs, competing with people who just through no fault of their own, you're competing against people who happen to be at an organization that invested in AI training courses over the last 3 years, and you were not. You're in trouble. So I think it's more about adaptability and learning so that when the future comes, you're ready. Because if I were to say I know what the future looks like, I'm lying. Like, I don't know. I'm learning as much as I can and trying to be as adaptable as I can. Some marketing jobs are going away. I don't know which ones. Some new marketing jobs will be created, and I can speculate on that, but the truth is I don't know. I've always speculated that there'll be marketing jobs related to data, unstructured data. There's already like marketing data analysts, but that tends to be structured data, not unstructured data, which is what large language models allow us to do. So I expect that to be a new specialty. Somebody who's just focused on the data, because that's so valuable. And then you can imagine an AI agent builder, somebody who's building these AI marketing agents that do marketing research, that optimize campaigns on our behalf. Because though they already exist, they're just not too good, but eventually they'll work and somebody will need to build them, deploy them, and manage them. That's a new role because somebody needs to understand that. And that's what I expect will happen, but who knows?
how informed do you see the healthcare space around AI from a marketing perspective? From our view, like I always see healthcare as kind of a little bit more glacial, and we haven't seen a lot of conversation around. Like, are you informing and bringing the conversation to the table within the healthcare space, or are they coming to you informed?
Yeah, interestingly enough, I tend to do, like over the last few years, a lot of healthcare conferences and a lot of e-commerce conferences. So e-commerce is well ahead in terms of, even I was working with e-commerce brands before ChatGPT, where we were deploying AI because they demanded it. And I'm an AI guy. Like I studied AI in grad school, so I've been the guy to come to for AI for a while for AI marketing. But I had people coming to me before ChatGPT, and they were all e-commerce brands looking for AI for marketing. So I would put it, and let's say like right before ChatGPT, where that space was, where e-commerce was a lot of people were just starting to experiment with AI. And for the most part, they were using like GPT-2 through the API because ChatGPT didn't exist. Nowadays, like e-commerce is pretty far along because they embraced ChatGPT on day one. And a lot of e-commerce, and not all of them, I'm just talking about the ones that I work with, right? Because that's why they come to me. But then the healthcare brands that come to me, they're just starting to work with AI. So I would say, based on my anecdotal evidence and only the brands that I work with, the healthcare brands tend to be about 2 years behind. And that's fine, right? Because you're you're competing with other brands. Like where it becomes an issue is when and if you're competing with startups that are like AI first organizations that might be able to offer the same services you offer online or something like that. And in healthcare, there's some opportunities like that and some opportunities that, I mean, or some areas that healthcare that will never go online and never be disrupted by a startup, but that's where it could be tricky. If you're a hospital network and you've got regionally like a few other hospital networks that you compete with, then you really got to look at your competition set, and you're probably all at the same spot. Really, you just have to make sure that you're learning. Like 2025 for you needs to be a year of learning. For my field, my agency, and the e-commerce folks, 2023 was the year of learning.
When you think about your healthcare experience, is there any examples that come to mind of just like good tactical applications of AI, or just anything? You and I before recording were talking about the one online addiction example, if that's the right lens, or maybe something else.
Yeah, I mean, I can give you two I can think of, but most of them tend to be startups. That's the thing, like, because they're way out ahead. But one of them in the online addiction space, what they were doing was, I mean, everybody that came to them online wanted to understand whether they were going to be covered under their insurance. So we helped them to build a chatbot that there was an insurance coverage database behind it. And you could chat with it to understand whether it was likely, because we can never say 100%, but you could chat with it to understand whether it's likely the treatment was going to be covered. And then after that, you get on the phone with an enrollment agent. And then there's another example where they were generating content. I didn't think this was going to work, but it actually worked well. They were generating content, and it's very risky to generate medical content with AI. In fact, like I told them not to do it because it scares the hell out of them. But what they were doing, and somebody listening to this is going to understand the space a lot better than I do, but they were summarizing medical information in documents that are delivered from pharmaceutical companies to physicians. And apparently, as long as they don't say anything that's not in that medically approved document, they can actually write whatever they want and put it online. And they were able to do it such that these articles were completely generated by AI and then vetted by a human physician. So they had a human physician they paid a ridiculous amount of money to just vet everything, but they didn't have any writers. So they actually saved a crap ton of money on the content because it was such an efficient process. The physician never found any issues because the physician just needed to make sure everything was in the information that had been delivered from the pharmaceutical company. So that's how they were able to make sure it was medically accurate.
It's interesting, and I can't say I speak to that scenario specifically, but what it makes me think of and triggers, and I think I've heard you reference this of kind of how you use AI and how you recommend is more limiting the source that you're pulling the information or content from. And the way I think about it in healthcare for us, we go, well, like anything that this generative AI produces has to be limited to this data base that pulls from PubMed or X association.
That would be the best way to do it. But still, even now in 2025, I'm not recommending that people create medical content with AI. Like that's got risk written all over it. Your lawyer's going to tell you not to do it, and I'm going to tell you not to do it. Sure, I know people have gotten away with it, and there are plenty of people doing it. But typically, you'll have a writer that's, basically, let's call it like an AI-assisted writing process, right? That a human writer has, but it's still like medically vetted by a physician. That's the process that I see.
Mm-hmm. In that first example too, I'm curious to understand is like, because I would just not categorically put that into SEO, but in that example, I think were you analyzing that this brand had traffic and that their problem was the insurance verification, and then you actually helped them build this agent to
what they wanted to do was generate as much content as possible related to the drugs that they had offered as a part of their treatment program. And the way that they could generate like medically validated content was through this method. And so it was designed to take the information from the pharmaceutical companies and basically repackage it to go after many different types of search intents. So there are search intents related to specific drugs, but then also symptoms, treatments that they're associated with. You can really blow that out when you look at everything somebody might be searching for related to a specific drug. So they're repackaging the same information on different pages and publishing it in a lot of different places and trying to do that super efficiently without hiring, an army of medical writers is what it comes down to.
You've touched upon this along the way, but I always like to just directly ask this question too, is like, what is your definition of authority?
What I believe the right definition of authority is really has to do with offline authority. It has to do with trust. Like, should I trust the information that I'm getting from this source? And in the healthcare space, I mean, I might be asking, do I trust them enough to go walk into the facility, ask them to render me unconscious and perform a procedure on my internal organs, right? Like, that's a pretty high bar for, I cannot think of a higher bar for trust, just to be honest with you. And I'm married, right? Like I put a ring on the finger, and still, like, I got to trust my doctor, because this guy, if he messes up, I'm under the knife and I'm unconscious while the whole thing's going down. So I think authority really has to do with, why should we trust this brand? And Google's looking for reasons why Google should trust it. And then Google will recommend it to us.
Awesome. I appreciate it all the time, Dale. I feel like I should ask again. Is there something I should be asking you that I haven't, outside of if I still have a job?
We'll stop it here, because we might get way too personal if we go down there. Okay. No, it was a fun conversation, so we should do it again.
I appreciate the time, Dale. Where is the best place for people to connect with you if they want to learn more and engage with you online?
So I'm at fireandspark.com, my website, all spelled out, fireandspark.com. And I'm on LinkedIn. I try to post every day, actually, on LinkedIn, various ideas related to AI and SEO and how SEO is changing. So I'm Dale Bertrand on LinkedIn. You can look me up. And feel free to reach out. Like, if you have any questions, I'm Dale at fireandspark.com. You hit me up directly via email. Like, I love talking about SEO, AI. If you've got anything going on, you want a second opinion, let's talk.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve, and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.